Hi, Mr. Jones. I'm going to explain the difference in primary, secondary, and complicated hypertension. In primary hypertension, there is no clear cause why your hypertension is happening, and it develops over time. It's not related to another medical condition. In secondary hypertension, this is hypertension that is caused by a medical condition. So, for example, if you have blocked arteries in your kidneys or abnormal levels of hormones that can control your high blood pressure, there is a reason for secondary. Complicated is high blood pressure that is difficult to control or manage. So sometimes we can provide treatment for the high blood pressure and we kind of struggle to bring it down. It's complicated to treat. So based on the data you have provided us, there are a few significant things we should talk about. You are an African American male. In adults, hypertension is higher in non-Hispanic Blacks and in men. Your parents also both have hypertension. We can have variants in our genes that are associated with secondary hypertension. You also do not pay attention to eating sodium and fats and carbs. And when you eat too much of these foods, sodium causes fluid retention, and when we have a lot of fluid retention, it increases our blood pressure. I also saw that you drink several beers. 2 to 3 drinks in one sitting can lead to hypertension. And lastly, you have gained over 20 pounds, which it has been seen that obese patients with hypertension have an increased sodium absorption, which, like I said earlier, increased sodium absorption leads to fluid retention, and this can increase our blood volume. So all of these things, we can talk about how we're going to work on them in a little bit. One complication of hypertension is a heart attack. So let me explain this better. When we have a high blood pressure, our blood is pumped through arteries with more than normal pressure. So there's excessive pressure, and then our arteries get hardened from this pressure. When our arteries are hardened, it decreases the flow of blood and oxygen to our heart. If we have decreased flow of blood and oxygen to our heart, we increase the risk of a heart attack. To talk about how we can prevent you from having hypertension that can lead to an MI, I would suggest us talking about putting you on a blood pressure medication. Some of the other things that you can do if you don't want to be put on a blood pressure medication is increasing your exercise every day or working out a few times a week. Regarding your diet, you can try and monitor how much sodium you eat and carbs. Try and eat a diet high in protein with fruits and vegetables, and I can also print out a worksheet for you that goes over a diet for high blood pressure. Also, limiting your alcohol consumption. These are all important things that can prevent you from having a high blood pressure and lead to bigger complications. If you would like to try the blood pressure medication, we can have you follow up in the office in 2 weeks to check your blood pressure and see how that medication is going. Thank you, Mr. Jones.